So the HSE has a number of priorities for its digital transformation. The key focus is the electronic health record, which is a four-pillared programme to deliver digital solutions into healthcare, whether it's acute, community, integrating all those systems, or indeed putting the patient record in the patient's hands themselves. Digital disruption in healthcare is a very different area. What the disruption that's happening in healthcare is that patients are consumerizing digital and using digital solutions to help provide care themselves. And clinicians often have a more powerful computer in their pocket than those that have been deployed by the healthcare system. And that's where the disruption's really coming from. The HSE over the last 3 years has put in place a number of startup engagement programs where we can start to help startups with wearable devices that can be prescribed for people who've had heart surgery, for chatbots to be developed to enable the handover of patients during A&E changes, etc. So a real big difference is that the disruption that is impacting on other businesses is actually being used to change the healthcare system in Ireland. So I've been a CIO for the last 7 years in healthcare, and the role continually evolves. I think when you look at magazines like CIO magazine who look at the different ways that the CIO roles change, the influences on that, in healthcare in particular, I've always said the CIO role is a leadership role. It's not an IT role, it's not a technology role, it's about standing at the front and showing people the business change, the way that things need to evolve to truly adopt digital into healthcare. And that's a really big part of the CIO role now, is more a communicator, an engager, that the role is a leadership role, not a technology role. And I think that's become a really big part of what we look for when we look for the next CIOs in healthcare systems. So the HSE's infrastructure that we rely on for delivering a digital change is quite a traditional infrastructure at first. If you think about the fact we have 109,000 employees who work in health, we need to digitally identify and empower those people. We need to move to a mobile-first solution, and that's something in the last 12 months we've done. 12 months ago, the Health Service in Ireland came up with a cloud-first strategy. So everything we do first has to be identified as a cloud solution, and only if it shouldn't be do we consider doing it anywhere else. Digital identity for people who are using the healthcare system is also important. How do we actually identify our patients? And in September of last year, we had the ability to go live with an individual health identifier, a way of digitally identifying uniquely and safely every patient in Ireland. So there's a huge infrastructure piece that's been done over the last 3 years that we can now start to build upon. So one of the roles of a CIO has to be at board level. During transformation, during a digital change, we're talking about business change. We're engaging clinicians, we're engaging our leadership team, we're engaging the top leaders of the organisation. If the CIO role doesn't sit at the board level, then it's very, very difficult to influence that. Traditionally, a CIO role, particularly in public sector, would have often sat under the CFO, and the relationships need to be strong there. But actually having a seat at the table, being part of the HR discussion, the finance discussion, the operations discussion is essential to make sure that what digital can do, what it can disrupt and change, is part of everybody's agenda. The biggest challenge we face in making sure that the culture change from digital happens has to be the sort of way that people have been educated in delivering healthcare. Clinicians are extremely talented and extremely intelligent people. And then asking them to learn new digital skills is difficult. What we've tried to do is make sure that that new skill, that new way of working is around business change, is making it clear that this is about patient safety, it's about the efficiency of the healthcare system, it's about joining up care. In healthcare we talk about integrated care, putting the patient at the centre. Without digital, we can't put the patient at the centre of what we do. And that's been one of the messages we've used to try and engage and make sure that business change becomes at the heart of what we're trying to do. We've looked at many different tools to ensure that digital disruption happens. We've got a cloud-first policy that we work with Microsoft in particular to ensure the HSE looks at cloud solutions first before it goes to on-premise. We're working closely with a number of mobile vendors to make sure that we have a really good mobile infrastructure across the whole of the HSE, empowering clinicians with their smartphone to start to do more. But I think one of the more exciting parts is when you start to work with new startups, the social parts of the organisation, looking at how to embed the Facebook, Twitter type scenarios into what we're doing, and we're working with organisations to help us do that as well. There are specific advantages that digital brings to the healthcare sector. I think giving the patient their information on their own smartphone, in their own hands, allowing a patient to add their wearable device information to it or their experiences to that information. One of the hardest things a clinician has to do is ask a patient how they felt for the last month on a regular checkup. The patient has to try and remember, the clinician has to try and react. There's a clinical sort of phrase being used at the moment that every single outpatient appointment is like going on a first date. They haven't got the information in front of them beforehand, and that means digital can change that. Digital can now start to actually make sure that there's a relationship in place between the patient and the clinician. So the HSE is Ireland's biggest employer. 109,000 people work for the HSE. Digital changes the way we deliver healthcare. There isn't enough people delivering healthcare. There isn't a big enough budget to deliver healthcare to the citizens of Ireland. And digital is actually the only way the healthcare system of Ireland, and indeed any other country in the world, is affordable. Without digital, the cost of delivering healthcare, it becomes unaffordable as soon as 2025. For most countries, the US, Ireland, the UK, not countries that you would expect to be on the verge of collapse or in any shape, way or form, but countries that can afford these systems. So without digital, we have a real problem to actually make sure that the ability to deliver care is possible. As we move into a new digital fabric across Ireland, the risks around cyber, the risks around the threat of losing information becomes harder to manage. We're looking at a digital infrastructure now where more data can be taken. We're looking at the type of data that's perhaps the most impactful if it's missing. But we never worried as much when it was on paper. We never had the ability to audit who looked at paper. Digital brings us a new opportunity as well as a new challenge in cyber, because now we can see where information is moving. We can invest with organisations like Microsoft, like Google, like Amazon to protect information way beyond what we could do when it was in big folders in basements of hospitals. And I think that's really important, is not just to get worried about the cyber threat, but to remain aware of the legacy of paper and how impactful it was to actually try and secure that as well.